Hello and welcome back to my YouTube channel. Today we're going to look at focus content for taking an accurate blood pressure, and this content will help you to ensure accuracy in your blood pressure readings. It's very important that we maintain accurate blood pressures for many reasons, some of them being that we need to have a history on a patient and each time measure the blood pressure against the next to see how that change is going, as well as it can be used to diagnose and treat the patient for many different disorders. So let's go ahead and get started. If you like this content and it's helpful, please remember to subscribe, and here we go. So when we're looking at taking accurate blood pressure, it's really important. I always include wash your hands. Step number 1 is always wash your hands. It's the number 1 way to break the chain of infection. And so whenever you're doing any procedure, you gather your supplies and wash your hands. For accurate focus content in the blood pressure, the first thing we're going to look at is that the patient is in the proper position. The patient should be positioned comfortably, and truly the patient should be given a few minutes when they come in to get comfortable and more relaxed. I know in the office setting, it's not always that easy, but if you really want an accurate blood pressure, that's a good thing to add into your routine. You also want to make sure that the patient's legs are uncrossed, because if their legs are crossed, you can get an inaccurate reading. Their palm should be faced up and the arm should be at heart level. And for the arm at heart level, there's several different ways you can accomplish this. You can have one of those medical tables that you slide over. I always like to do just like in this picture here, support the patient's arm for them at heart level while I'm taking that blood pressure. Then we want to look at the patient's clothing and make sure that the clothing is not too tight and that it's rolled up on a bare arm. To get the best blood pressure reading, you should be taking that blood pressure reading on a bare arm. In order to accomplish this, you can roll up the sleeves as seen in the above picture. You want to make sure that the sleeves are about 5 inches above the elbow so that they do not interfere with that cuff. You can accomplish this by rolling up the sleeve, by asking the patient to go ahead and take one arm out of their shirt, or you can also offer them a top gown in order to do this. In some establishments, they do approve for if it's a very lightweight, non-tight long sleeve shirt that you can take over that shirt. But in this case, when we're really talking about the most accurate blood pressure, you want to make sure that you're taking it on a bare arm and that you've taken care of making sure that there isn't any tight clothing interfering. We also need to make sure that we select the proper cuff size. It should fit comfortably over the patient's arm. If you take a blood pressure cuff that is too small and you take a blood pressure reading, your reading will be inaccurately, what do you think? Good, inaccurately high. So a small cuff that is too small for the patient will result in accurately high blood pressure reading. A blood pressure cuff that is too large for that patient can result in a blood pressure reading that is inaccurately low. So it's important to select that cuff correctly, and we want to make sure that the bladder can be located over the brachial artery, that the bladder is placed between the lines designated on the cuff. And I'm going to be doing several quick tips where I'll show you these things. Most cuffs have a white line on the inside. You want to make sure that the arrows over that brachial artery and that the white lines overlap, but not all the way around. If it's all the way around, then it's too large. And we usually see pediatric, normal adult, large adult, and we also have extra large adult. And in a very obese patient, sometimes we need to use a thigh cuff in order to select the proper cuff size. The next thing we want to look at is proper cuff placement. So when we're placing that cuff, the bladder should be located over that brachial artery that we're going to palpate. Then the bladder should be between the lines designated on a cuff, like I said in the previous for the cuff size when you're selecting the cuff size. The cuff and the tubing should not touch the stethoscope. This is so important because you will get artifacts and that will lead to inaccurate readings. And we want to make sure that we place that lower edge of the cuff about 1 inch above the palpable brachial pulse. So when we find that brachial artery and brachial pulse, that cuff should be about 1 inch above so that we have room to set our stethoscope just right above and in the antecubital fossa there. So those are ways that we can make sure that we place that cuff correctly. Now, something I see very often and I want to bring your attention to is the earpieces. If you don't have those in the ear canal, it's very, very difficult to hear the blood pressure sounds. So a lot of times we don't realize that those earpieces are pliable and you can turn them, you can move them in or out. So when you're placing them into your ear, you want them forward so they go properly into your ear canal. And with this, again, I'll be doing a quick tip showing you this, but I also included a picture above of the no. You don't want them towards your cartilage. It's very hard to hear the sounds coming out. You want them into your ear canal. And this is very, very common when you're first starting out. There's so many things to remember. So don't worry, it will become a habit for you. Also, the proper stethoscope placement. When we place a stethoscope, we want to make sure that we have it over the palpated brachial artery on the adult or in that bell area of the pediatric patient. And again, when we find the brachial artery and we place the cuff 1 inch above that, that leaves us the space of the antecubital fossa and just right above that to go ahead and place that stethoscope. You want to make sure you form a seal around the head of the stethoscope, and that just means the head is firmly over that area and it's not pointing up one way or another where it can get exterior sounds. These sounds can definitely interfere with you being able to hear the blood pressure correctly, so make sure that you form a nice seal. I love the Littmann teardrop and I use the Littmann teardrop. So on one of my videos, I'll show you what that looks like because you're able to get it in the right location so nicely and your fingers fit nicely around that head so that you don't put your thumb or your fingers on top where that can cause interference and an inaccurate reading. But just make sure that you don't put your fingers on top or your thumb on top, that they're helping to seal that head in the proper place. And then we want to look at our cuff deflation. So when we open the valve, it's really important that we open very slowly and slightly at a constant rate because we want to be able to hear the sound as it comes. And if we go too quickly, we're going to miss that systolic sound. And if we go not fast enough, it builds up the pressure and we're going to get an inaccurate high reading. So what I suggest to my students is always to take a blood pressure cuff well before you're really starting to do the process of taking blood pressures and just practice whichever hand you've decided is going to be the hand that you hold the bulb in. You want to make sure that you put the bulb in your hand and you just practice inflating the cuff and then using your thumb and finger to slowly and slightly at a constant rate open up the valve. And then just once it's deflated, do it again, pump it up, practice slowly and slightly deflating. And after a while, it just becomes natural to you and it will be so helpful when you are really beginning to take those accurate blood pressures. Now, when you're taking that blood pressure, it's important to remember that you're going to hear a first sound And if you have everything on correctly, there shouldn't be any exterior sound or artifact. So that first sound is the systolic, and then it's really, you'll keep hearing that kind of constantly and it'll get softer and softer. So I always say that second sound is actually truly more like an absence of sound, and that is the diastolic. Also, remember that if you need to retake a blood pressure, you need to wait 30 to 60 seconds. And I like to wait even longer on that to give the patient time to kind of regroup and relax so that you can get that accurate reading. And then you have success. It's so important to perform a blood pressure accurately with the correct techniques. And most importantly, it's important to keep our patient comfortable. And as always, we want to wash our hands at the end of any one of our procedures and document accurately so that the doctor has the accurate information in order to help diagnose, or the provider. I hope that this was helpful. Again, look for my other videos. I will have videos related directly to this with quick tips and many, many more. I'd like to thank you for your time. If you want to visit me, you can visit the YouTube channel, or you can email me at adventuresandlearning.info@gmail.com, as well as visit my website, which is adventuresandlearninginfo.wordpress.com. I hope you have a fantastic day, and I look forward to seeing you online, and have the best adventure in learning. Bye-bye.